Good afternoon. My name is Andrea Schlesinger, and I am the owner of Sarasota Healing Connection, located in beautiful Sarasota, Florida. I have been practicing for over 21 years, with specializing in rehabilitation massage, myofascial release, pregnancy massage, the other deep tissue types of techniques, and Thai massage, just to name a few of the muscle therapies. I also do energy work, and I am a Reiki master in Usui as well as Shambhala. I also do axatonial light grid therapy, and I do my own work, molecular cellular restructuring therapy, which includes sound healing, transformational breath techniques, and basically to work on balancing. Because the goal is to have your chakras and yourself balanced out so that you are living in wellness. Having a connection with the universe and bringing yourself to a place of peace and balance. Now, one of the other things that I do, and it's kind of fun, I have a partner in a company called Diva Days. And what we do is, Debbie Morrissey and myself go out to locations to just have a day of pampering. We do this with couples, we do this with women, we can also do this with teenagers. And what we do is we offer a complete service. Miniature service, because obviously it's not like coming to our studio. But we do massage, we do facials, we also do hair as well as nails. And there may even be somebody who actually may be doing some wine tasting or working out some details. And we hope that people really take the time to come to my website, sarasotahealingconnection.com, to really see many things that are available. Also, I have a blog, so I talk about the therapies as well as other topics as I see fit and see will it be appropriate for the audience I'm targeting. Today, I'm going to talk about something that's amazing. It's called cranial release technique. I took this with Dr. Bill Dorset, who lives in New York City and has a home in Miami. He came up with this technique that has blew me away and blown my clients away. It is a technique that only takes a minute. Basically, you're working with the 22 cranial bones in the head. And these cranial bones actually move. For people who are not aware of it, this is not cranial sacral. This is a different type of therapy. And with the movement, everything starts in the brain. And what I'm doing is a cranial correction. This cranial correction allows the body to work from the inside out and change how the body is to balance or homeostasis. And our goal is to always be in perfect harmony with our body. And of course, eating well and doing all the other exercise and drinking enough water also is important. But what this does, it corrects problems. And you're wondering what I have in my hand. Besides that it's a fun toy to play with, this is to an explanation of what actually really happens, especially when a baby is born. If a baby is born vaginally with no forceps and no C-section, the baby's head is compressed, it comes out, and when the baby comes out, his brain opens up and starts kicking in. And that's the way it should be, and this is why this technique is so amazing. If I work with mothers who are pregnant and want their child to have this benefit, I can do the CRT on them, and this for even if the child ends up as a C-section or a forceps birth or a vacuum, it turns around and amazing things happen. The child is actually opening and the brain is moving and functioning from the time they come out of the womb. And I'm going to give you a couple examples of some of the amazing things that I've seen with cranial release. And why, even though it only takes a minute, how profoundly it changes your body. Another type of example, I have a patient that I'm seeing right now who fell on a sidewalk. She has been suffering and she's been limping. So what I did was I measured her to show her exactly where the imperfections are. And she put her on the table, and one session she was walking normal. I've now seen her twice, and it's amazing. Each time it seems to be holding better than the last time. I've had another patient who had 3 concussions, one of which was so serious she had a fracture in her head. And I couldn't believe it. She actually could feel the difference. She says things are moving on the right side. I haven't been removed for a very long time. So if you really want to know more about cranial release, you can go to cranialrelease.com and go look at the videos. There's one amazing video, and I'll just interject, and then you can actually see for yourself. Dr. Dorset has a nephew that was born with not Down syndrome, but a type of Down syndrome, and what he did for this child is a miracle. He wasn't able to see his wife's sister's child born, but he came 4 months later, and he started working once a month, and then eventually brought in one of the students that had gotten trained by him. And that child went from looking dull, having eczema, I mean the eyes looked blank, to totally vitalized and revived. It was so amazing that now, almost 3 years later, I think his birthday's coming up in July, the child's a normal child, has no learning disabilities, no problems. I can tell you story and story and story about this technique. But if you don't try it, you're missing out an important part of your healing process of getting your body balanced. But I've done well over 100 people, and they keep coming back to me saying, this is the most amazing thing. In fact, my doctor, my chiropractor, where the place I work at, Natural Healing Arts, he had an injury on his right shoulder. He had done kayaking. And what happened was, he never got better. I have not done any massage. All I've done is the cranial release. And I can tell you right now, he's doing amazing. He said he's 95% better. So, you know, please consider coming and seeing me. And if you book a massage, your first CRT is on me. But right now we're going to do a demonstration. You probably will not look like much of anything. The point that I place my hand is called, and in Chinese medicine, it's called the gateway to the brain. And everything comes from the brain. So I'm going to have Smiley come forward. I'm going to just show what it's like, the things that I do to show what I want to be looking for.